Live from Studio 46, this is CBS 2 News.
Every year, nearly 5.5 million cases of skin cancer are diagnosed in this country.
And even more surgical biopsies have to be performed to tell whether a mole is cancerous. But CBS 2's Dr. Max Gomez is here to tell us a simple device can often identify a skin cancer in just seconds. Doctor.
That's right. You know, skin cancer can be sneaky. Innocent-looking freckles or moles can sometimes be cancerous and can fool even experienced dermatologists. That's why doctors will often biopsy spots that just look suspicious, leading to unnecessary cutting and scarring. Here's a simple tool that can eliminate a lot of those biopsies.
I produce lots of moles all over my body.
Mia Brill is what doctors call a mole maker. It's partly genetics. Her grandmother had melanoma in her 20s, and it's partly because Mia grew up on the beaches of South Florida. That's what led to...
I've had probably around at least five biopsies, moles that they wanted to check.
Not surprisingly, that's left Mia with scars she'd rather avoid, as long as she knows those moles and freckles are benign. Not always easy to tell.
Most of the time when we suspect that someone has a mole or a freckle that looks a little unusual, we'll have to do a biopsy. And someone who has a lot of freckles and a lot of moles often needs to have a lot of biopsies. These look fine, Mia.
But now dermatologists have a device called a dermatoscope that tells the doctor a lot more about a mole or freckle than what can be seen with the naked eye.
We can really look not just on the surface of the skin, but a little bit below, and often see what kind of pigment there is, and also the distribution of the pigment.
Here's a pretty common looking freckle, for example, but the dermatoscope shows the mottled pigmentation that means precancerous mole. Biopsy required. A similar looking spot on the hand looks very different under the scope. Diagnosis, actinic keratosis. No biopsy, just freezing off with liquid nitrogen. This one looks like a pimple on the nose, but it's a basal cell skin cancer. Biopsy and excision. Bottom line,
we can often save people from having biopsies that are unnecessary.
I do not like scars. It's not fun to have a million scars all over your body.
Now, the dermatoscope won't prevent all biopsies. It can divide moles into benign, suspicious, or malignant. Malignant ones get biopsies. Suspicious ones might get biopsies or sometimes just observe for a little while to see if they change. So the scope still avoids a lot of cutting. And the secret there is polarized light. That's what allows it to see a little bit under the surface.
Got it. It's nice to have that option, though,
Yeah,
right?
it sure is.
Thank you, Dr. Max.